Why is your cardiologist prescribing diabetes medicine? I'm sure you may have wondered that if you're a heart failure patient who has been prescribed a medication that you've looked up on the internet and seen that it's purposed to treat diabetes management. Let me help you understand. Lock in and let us learn. On today's episode of Make It Make Sense Cardiology Edition, I am going to walk you through SGLT2 inhibitors and their beneficial effect on heart failure. SGLT, sodium glucose cotransport inhibitors. That's a mouthful. That is an absolute mouthful. Let me break it down for you. It is this category of medicines that, yes, while they were initially created to treat diabetes, type 2 diabetes management, they were initially created for that 100%. Over the course of time, clinicians have discovered that they have a benefit when it comes to heart failure patients also, because of the way that they work. Now, the mechanism of action, nursing students pay very close attention. New grad nurses who are on any sort of cardiovascular unit pay very close attention. The way that these medications work, they actually block the reabsorption of both sodium and glucose in the kidney. When you block that reabsorption, you cause the kidney to actually push both sodium, excess sodium, and glucose out through the urine. That's a diuretic effect. One of the mainstays of heart failure management is diuretic management. Make sure that your patient does not get too volume overloaded, or make sure that they don't retain too much fluid. So the diuretic effect that comes from this category of medications, that's one of the benefits for heart failure patients. Secondly, remember we said that it blocks the reabsorption of glucose, and that's the way that it treats the diabetes that patients may have. Diabetes is a huge risk factor for heart failure or cardiomyopathy. Diabetes results when there is an excess of glucose in circulation. Sugar molecules are big, much bigger than red blood cells. But nonetheless, when you have excess glucose molecules in circulation, that can cause the inner lining of the artery walls to become inflamed. Inflamed walls increase, or inflamed arterial walls increase peripheral vascular resistance. So if you've got the artery here, right, the inside of the artery wall, if it becomes inflamed, the vessel is going to become tighter. There's less space in the middle. That means that the heart has to work that much harder to push blood through tightened blood vessel walls. If your heart muscle is already weak as a result of heart failure, you don't want to put an additional workload on that already weakened heart muscle. So these medications, these SGLT2 inhibitors, they have a twofold effect when it comes to heart failure management. Volume reduction by way of the mild diuretic effect, and it also keeps the risk of diabetes low. Or if you have a patient who has CHF and is on this medication, it'll help keep their diabetes under better management to reduce that arterial inflammation. There's your cardiovascular benefit. Now, these medications, the names of the and I never say them right. Let me go ahead and apologize in advance. The names of these medications that are most commonly used are dapagliflozin, and I know I didn't say that right. That's the generic name for Farxiga, or empagliflozin. And again, if I mispronounced that, I am so sorry. But that's the generic name for Jardiance. And again, you know, they're very beneficial when it comes to heart failure management. So if you see these medications in your patient's arsenal, or if your cardiovascular provider, cardiology provider has started you on these medications, that's why. That's why they're trying to help support your heart as best as possible by keeping fluid volume under better control, and to try to keep any risk of diabetes as low as possible, or any existing diabetes as best controlled as possible. That's it. Hope that was helpful. Like, follow, repost, share with all of your nursing students, nursing colleagues, anybody who has an ear to hear. Let me know what questions you might have. You know how to reach me.